working in the spirit of the Golden Empire. This is a 17 News Break.
Good morning from the 17 Newsroom. Good to have you with us. I'm Maddie Jansen, and we are awaiting our weekly update from county officials and public health about the latest number of COVID-19 cases in Kern County, as well as reopening operations across the county. The numbers for this morning were just released a few minutes ago. They show that 73 new cases have been diagnosed here in Kern County, and 1 new death was announced this morning. That brings our total deaths to 361. So far in Kern since the pandemic began. This morning, that brings our total of cases as well to 31,785 cases. Again, 73 new cases this morning. County officials said previously we need to average around 63 new cases a day in order to meet state metrics and move up another tier for reopening. Let's listen in now. This is County CAO Ryan Alsop.
Not here today. She is with members of her communications team in Fresno County, assisting Fresno County with their emergency operations related to the Creek Fire. And she is obviously joining a bunch of our Kern County firefighters who are up there fighting that fire, also in leadership positions, helping Fresno County, assisting them in managing through this crisis. So we thank them for being there in their service. Today I've got Matt Constantine and Kim Hernandez here from Public Health, and we also have a special guest here with us that I will introduce to you in a bit. The numbers today in Kern County, we've tested over 190,000 people to date, and to date we have had 31,785 test positive, 31,304 or 98% of those residents who tested positive to date are either fully recovered, presumed recovered, or are isolated and recovering at home, treating their symptoms on their own. This statistic has been the same since we began tracking this virus's transmission here in Kern County. A couple of notes on the governor. The state earlier this week announced that nail salons may resume indoor operations statewide with adaptations and operating under guidance. Here in Kern County, nail salons may begin indoor operations today following the state's issued guidance for that industry. Nail salon owners and their employees can get this guidance and this information on how they are to begin operating at COVID-19.ca.gov. That's the state's website. Kern County remains in the purple tier of the governor's blueprint for a safer economy. The state updates this information only on Tuesdays. We'll wait to see where we are when the governor and his team discuss this at their press conference next week. I was supposed to have Matt Constantine come up and start this before I did and messed up there, but Matt will be following me here in just a second to talk a little bit about some of the numbers today. Our board on Tuesday, the Board of Supervisors unanimously approved a resolution calling on the governor to provide greater clarity, consistency, and continuity in his administration's directives to California counties, our business communities, and our residents. The board is demanding that the governor work more closely with counties in developing the pathway for increased business activity and school reopening, and that he not continue to move the goalposts on counties. California counties, our business community, and our schools should not be penalized for achieving newly announced state goals and objectives that have little to do with flattening the curve, which at the start of this pandemic was all about maintaining hospital capacity. A letter with that resolution has been sent to the governor, and it has been shared with other counties. A couple of notes on testing. As we have discussed previously, the governor is tying wider reopening of our economy and wider reopening of schools to testing rates in each county. The state is putting an emphasis on how many of you are getting tested here in Kern County. We need to increase the number of tests we are doing here in Kern County in order to move more quickly through the state's tier system in order to get more of our businesses operating indoors, more of our schools reopen. while getting tested is voluntary. We're asking our residents to go out and get tested. Please help us out. You are helping us move more quickly through the tiers. You're helping our business community get open quicker. You're helping kids get back into school quicker. So we thank you for putting an effort into going to get tested. There are 9 free testing sites spread throughout the county, either accessible for walk-in or drive-up services. And to find locations and to make an appointment, you can go online at kerncounty.com or simply call 211 to get information on testing sites. And as we all know, most local healthcare providers in our community are providing testing. This includes Omni, Clinica, Sierra Vista, Kaiser, most urgent care centers. All of those entities provide testing. So with that, I'm going to ask, a little out of order, sorry, Matt Constantine to come up to give you some of his remarks.
Good morning. This morning we are announcing 73 new COVID-19 cases that have been diagnosed in Kern County and 1 new death. As Ryan has briefly mentioned, the state releases new monitoring metrics every Tuesday morning or sometimes in the afternoon. And last Tuesday, the 22nd, the state released information about Kern County. The case rate, the number of average new cases per 100,000, averaged over 7 days, was 6.3. We need to be below 7 to move into the next tier, or that red tier. It was 6.7 the week prior, so that's trending in the right direction. The adjusted case rate, however, is now 7.2, so that keeps us into that purple tier. However, previously it was 7.5, so we are trending downwards. On Tuesday, the governor and the state also released information about our testing positivity. That's the number of individuals that are testing positive. That is also averaged over 7 days. That was at 6.5. It needs to be below 8%, so that also is trending. It was 7.1 the week prior. So all of these numbers have improved. As Ryan did mention also, the adjustment, though, is being added on to our numbers to increase our case rates because of our testing rate. Kern's average testing rate as of Tuesday was 141 per 100,000, and the state's average is 216 per 100,000. That is down from the week prior, which was 150. This is a metric that we want to move in the opposite direction. So as it stands now, we need to test about 690 new individuals per day to get that adjustment to be removed from our case rate. With that, I'm going to turn it back over to Ryan.
Thanks, Matt. Again, on testing and the need for our community to get tested, I am pleased this morning to have with us Matthew Riley, who is the president of the Bakersfield Condors, who I'd like to ask to come to the podium to make a special announcement. Thank you.
Thanks, Ryan, for allowing me to be here. I also want to thank Ryan and Matt Constantine and their staffs, everyone with the city, the county, the health department, for their tireless efforts that they've put into helping our community get back on its feet. Also want to thank the media for keeping the citizens of Kern County in tune to how to get us healthy and how to get our economy rolling again. 6 months ago, our season was interrupted, and more importantly, everyone's lives was negatively interrupted by this pandemic. And since then, we've been trying to keep our head above water, just like everyone else. I think probably no one has been without effect during this time. So, you know, we always want to do what we can to help the community, and we've been racking our brains with how we could do that during this time. As we've learned more about the metrics and so forth and how we're going to get back to normal, became apparent that the community needs to do more testing. So we wanted to encourage folks to do that. And in an effort so, we, in conjunction with the Mechanics Bank Arena, are announcing that anybody tested from now until November 15th, you'll be entered into a drawing to win 2 tickets to every event in the arena in 2021. So hopefully this will bring some additional awareness to folks, and they'll get out there and get tested. It's easy. I've done it. I'll continue to do it, to do whatever we can to get people back to work and help Kern County and the citizens involved. Thanks.
Thank you for that, Mr. Riley. We appreciate it. That is every event in the Mechanics Bank Arena, not just Condors games, but these are hopefully concerts, the entire season of events at the Mechanics Bank. So all concerts, every single event. Thank you. That's fantastic. Let's hope that happens, and please get tested, and hopefully you know, you can enter your name and get chosen for that. We're going to go into questions now. We've got members of the media on the line. Your phone should be on mute. When I call on you, you press *6 to be unmuted, and you can ask your question. I've been given a list here of all of the different media outlets that have questions this morning, and I'm going to start with Channel 23.
Can you hear me?
Yes.
Good morning.
Good morning.
Well, I have 2 questions this morning. And I'm going to preface it a little bit just so that you guys understand what I'm trying to get answered. All right, so the federal statute provides for 2 different methods for you to determine when it's okay for you to release patient data without violating HIPAA. Now, it's been a big question about whether or not public health can release ages and ethnicity related to those who have died of COVID-19. So the first way we were able to determine that you guys could do that is using the expert designation method, where you can hire a statistician, and that's what the county did. Then there's the second method, which is the safe harbor method. Under this method, 18 identifiers such as name, social security, data, birth have to be removed to help protect the patient's identity, as you all know. So under the second method, you could have theoretically provided additional information around the age ranges and ethnicities of individuals who have died of COVID-19, according to the HIPAA statute 164.5C2, with the safe harbor method, which was the second method that I just described. So the first question that I have then is, why did you guys choose to use the expert designation method? And the second question is, do you think the public would want to know this additional information about who is dying and where of COVID-19?
Okay, there's a lot to unpack there, but I'm going to have ask Kim Hernandez from Public Health to answer that question.
Hi, Tori. Good morning. Thank you. It is a good question. It's one we've continued to work through. As you know, with the safe harbor method, if you look through those different identifiers, one of the pieces that is really a part of the identifier is the geographic information, and the safe harbor method does not permit releasing geographic information below the first 3 digits of the zip code. Because we have already released information related to zip code in all of our cases, that affects our ability to release information regarding those deaths. So we are continuing to work with that statistician. We do hope to be able to provide more information soon, but because you have to take all of these elements together, at this time we're not able to release it. We thank you for your patience. We know this is something our community is very interested in, and it is some information that we want to get out to our community, but we need to make sure that we do it in a way that protects the rights of the people who have died and the family members of those people, and that we can get good information out to you as soon as possible. We continue to work on it. As soon as it's available, we will be making that public.
Yeah, so I guess the question is, from the start, didn't you think that that information would be important? If you knew both of these methods existed and there was a method you could use to release more information, I guess my question is, why wouldn't you, if the federal government doesn't think releasing this information threatens the privacy of citizens, if you could have just released the first three numbers of the zip codes of those who tested positive and or died of COVID-19, or combining maybe a percentage to keep it even more general? If you already knew all of this information going into your decision whether or not to release zip codes, why didn't you choose the safe harbor method to use just the first three numbers of the zip code?
Hi, Tori. We did. We actually considered that very early on when we were developing our dashboard. The first three digits of the zip codes, there's only 3 in our community. And so with those first 3, there's 933, 932, and 935. And so that breaks down Kern County into 3 regions. That didn't seem like it was enough detail as we talked to our community, as we talked to our board members, of trying to get information about the geographical spread of COVID-19 in our community. And so that was why way back in the beginning of this, we worked with that statistician so that we were able to originally break it down in those 5 regions that we had originally. And then in working with that statistician, we were able to get the verification that we could give out the exact zip code of the number of cases per zip code. And so that was when we started down that path of working with the expert determination. So we're still going down that continuum. We're working with that statistician in order to provide that information. But we made a decision early on in order to show the spread of COVID-19 in our community that we wanted things at the full zip code level. So we're continuing to work through that to see what we can release. As soon as that conclusion is made, we will be getting out as much information as we can to the public.
Okay, it still sounds like you guys had an information in the beginning, but I'll wait for you guys to come back for follow-up.
All right, thank you. Kern Soul, you on the line? Okay. Mojave Desert News, Jack, are you on the line? *6 to unmute. Mountain Enterprise, are you on the line? Valley Public Radio, Carrie, are you on the line?
Yes, hi, good morning.
Good morning.
I wanted to ask about testing site utilization rates. And so I had talked with Matt Constantine offline earlier this week with just some numbers about the utilization rates at your various public testing sites. So I just wanted to know, what was the timeline on those, or rather the time period that those numbers were good for, if it was just for the previous week or something like that. And then B, I want to know if you have updates. I don't know how often those numbers are updated, but if you have any significant changes to any of your testing site utilization rates yet.
Okay, we'll have Matt answer that question.
Carrie, good morning. I can certainly provide you the detail you have asked for. If you will please email me, I'd be happy to review the date of those, the query that we ran, and then I can also provide you some updates as you have requested. As we've discussed, all of our sites are operating at or below approximately 50%, where a number of them are actually below 25% capacity. And this kind of goes to the larger discussion that we have the availability of our testing sites located throughout the county, both permanent and mobile and in some of the rural areas, but we still struggle obviously with trying to encourage testing to get us up to those numbers to get that case rate off. So Carrie, I don't have it at my fingertips, but I'd be happy to provide it to you later. So if you'll just email me, I'll get it to you.
Okay, great. Thank you.
Thank you.
That's it for me for right now.
Okay, Channel 29, Emily, are you on the line?
Yeah, I am here. So I have a couple of questions, but I'll decide which one I want to ask. Okay, so during the Board of Supervisors meeting, Matt Constantine seemed
pretty confident that even with this new case rate adjustment, Kern County could be meeting those red tier numbers by next week when the state runs their data again. I'm wondering if the county shares that same confidence.
You're asking, well, Matt is the county. Are you, I'm not sure what you're asking.
I guess I want to know, I know how Matt feels. I guess I want to know how you feel, Brian.
Yeah, I have very high confidence in Mr. Constantine and public health. I believe the Board of Supervisors do. I mean, that's why he's our director. He's got a great team around him, and I think that if Mr. Constantine is expressing optimism and confidence that we're trending down and meeting numbers, then we share that level of confidence.
Okay, great.
Okay. Channel 17, anybody on the line from Channel 17?
Hi, good morning.
Good morning.
So my question right now is, you had mentioned that the average test rate as of Tuesday is 141 people per 100,000, and we need about 690 to meet our testing goals. So we have to nearly quintuple the number of tests that are happening here in Kern County. And I'm wondering over what time frame will we need to keep that number? Over what time frame will we need 690 tests per day per 100,000 people?
Okay, let me get Matt to answer that question for you.
Good morning. So the number that I've given you is per 100,000. So Kern's average testing rate, as the state is reporting out, as of Tuesday the 22nd, was 141 tests per 100,000. The state's average is 216 per 100,000. If you subtract the difference between those and times it by our population, I believe the state uses a population of 920,000 individuals. We get about 690 per day. So we do need to increase. It is a lot of additional tests that we need to do, but it's important to also note that every additional test we do helps to make an incremental adjustment to that case rate. It's not an all or nothing sort of component. So any effort that we make to closing that gap will help us. And then just to, if I could, just to make reference to the previous question, we are noticing a downward trend on the numbers, on the metrics. That's a good thing. We've been seeing some decreased average daily cases. Since the state has converted to their new system, we've now seen we're 2 weeks where we have been coming down. We are hopeful that we'll continue that trend. We don't want to slow down at all. Obviously, the efforts that we put in place, all the efforts from our community and our businesses is making a difference, but this is where we actually want to try extra hard to continue that. And if we can continue that, our hope is in the near future we may be able to start meeting that red tiered metric and start that 14-day clock. We do watch this closely. We're going to anxiously watch next Tuesday. We're kind of on the border, and it depends on that adjustment, but it's nice to see that we're getting closer. So I wanted to be able to respond. Hopefully I answered your earlier question also.
Thank you very much. And just for clarification, so if we do have that rate, the 690 tests per day, then let's say we theoretically reach that this week, then would our adjustment on our case rate be, our testing rate, excuse me, would that be lifted by Tuesday? Would that be lifted by the next time the information updates?
Yes, I believe the county's testing is averaged over that 7-day period. I'll have to check, but I believe that's the case. So obviously we need to make sure that we hit that number every day or higher to make sure that that adjustment's removed, but it should be averaged over that period of time.
Thank you.
Thank you.
Yeah, we're just a quick follow-up. I mean, we're testing about 1,300 people countywide every day, and we need to do more. If you do the math, you do the 141 and you times it by our population, that's the number, and we need to be above that, and we're making an effort to get above that. Bakersfield, California, and Sam, are you on the line?
Hello. My question is about just the hospitalization numbers. I've been noticing that you guys have been reporting that they've been going down over the last few weeks, and I'm wondering, is this really hard evidence that coronavirus is less present in the community than it has been? Because, you know, the people that test positive, maybe they don't need to go to the hospital, but if you need to go to the hospital, I mean, you might go even if you don't know that you have coronavirus. So I'm wondering if that really shows that coronavirus is falling, you know, as hard evidence. Does that question make any sense?
It did. I'll just say before I ask him to come up, most people don't require hospitalization. The vast majority do not require hospitalization when they're infected with COVID. But with that, I'll ask Kim Hernandez to answer your question.
Good morning. We are cautiously optimistic about the decreasing number of patients in the hospital due to COVID-19. In general, with most illnesses, the number of people with severe illness is proportional to the number of infections that are out in the community. So we're hoping, and it makes sense as you see our number of cases continue to decline, that hopefully the number of patients that have to be hospitalized and stay in the hospital due to COVID-19 will also decline. So these things should happen to move in parallel. We know in our healthcare community they are grateful for this decrease in COVID-19 cases. Everybody's taking this time to take a breath and get prepared. We continue to monitor the situation as we move more and more into flu season. And so this is, you know, sort of a moment for everybody to continue doing all of the things that have been recommended in order to slow the spread of COVID-19. Most of those things, we call them non-pharmaceutical interventions, the hand washing, the distancing, the wearing face coverings. Those things are also something that will be helpful in reducing flu transmission. And so we know that as we get into flu season, there's a dual purpose in all of the recommended steps to avoid transmitting COVID-19 fall into ways to avoid transmitting flu. And that again helps protect our healthcare system, particularly our hospitals, and the number of people who have to seek services in our hospitals.
Okay, thank you.
Okay, I'm going to go back through some of the outlets for any follow-up, but I am being advised that Kern Soul, Mountain Enterprise, Telemundo, KNZR, KUZZ, El Popular, and Kern Radio are not on the line and don't have questions. If you are on the line, please speak up. And also, if you are an unknown, we've got an unknown number, unknown caller, unidentified. If you can speak up if you have a question. Going once.
I have a follow-up question. I have a few follow-up questions if no one else has any questions right now.
Okay, yeah, just a sec. So going once, going twice on all those I mentioned, unknown caller. Okay, we'll go back to 23.
Okay, so can you tell us how many kids have tested positive and how many had to go to the hospital, and did any end up in the ICU? So that's following up on the kids.
Yeah, we're going to have Kim answer that, but she's looking and coming up to the mic now. Thank you.
Hi, Tori. As you can see on our dashboard, which does have age groups between 0 to 17, that we have had 3,615 children under the age of 18 who have tested positive for COVID-19. At this time, we have not released the number of the age groups of people who have been hospitalized or in the ICU for the same reasons we've talked about regarding deaths.
Okay. Is there a reason the majority of children aren't affected is because they don't typically have underlying health conditions, which is shown to be a huge contributing factor to COVID-19 complications?
Hi, Tori.
Like, is there a reason why?
Go ahead.
Do you want me to rephrase the question?
Yeah, could you repeat it for me?
Okay, so is the reason the majority of children aren't affected is because they don't typically have underlying health conditions, which have also shown to be a huge contributing factor to COVID?
That may be part of it. There are probably other things involved, especially, from a personal standpoint during this time. I think a lot of us have worked really hard to keep our children separated from others. For the majority of this time, they haven't been in school, and we've worked really hard to protect our kids in particular. As you mentioned, they typically do not have the high-risk factors that have been associated with COVID-19, and so they're still looking into a lot of those differences, both here in the U.S. and internationally, about why kids may not seem as affected by COVID-19. But we are grateful that there hasn't been a large increase in children with COVID-19.
All right, and then any plans taking place right now in the public health department here in Kern County regarding how you would approach the situation if we did end up getting a vaccine? How would you plan to roll it out to our community? Have you guys started talking about that, considering the federal government announced its strategy for releasing a COVID vaccine soon?
Hi, Tori. We've continued to be in talks with the State Public Health Department as well as other health departments near our community. We are waiting for all of the guidance which is expected to come out from the federal government and then from the state of California about how COVID vaccine will be distributed throughout our community and about which populations will be prioritized. So we continue to prepare for that. We remind people that this is something that is not dissimilar to what happens when flu vaccine is rolling out, and that is happening now here in our community. So we continue to encourage people to get their flu shot, as we do every year, and that we will be prepared to move COVID-19 vaccine throughout our community as soon as it becomes available.
Okay.
All right, we're going to move on to Valley Public Radio again. Carrie, do you have any follow-up?
Yeah, I have kind of a more general question about just how we talk about where the cases are trending right now. And so in Kern County and across the San Joaquin Valley, the case rates and all these numbers really have been decreasing ever since kind of late June, early August. Is it safe for us to say that the first peak is over? Are we beyond that, or are we really not able to say that yet?
I'm going to ask Kim.
Or first wave, perhaps. I'm not sure. Yeah.
Yeah,
Sorry.
Understood. Kim's going to answer that question.
Thanks, Carrie. That's a great question. If you look at our dashboard and you look at sort of the epi curve that we have in the number of cases, you can see that we have been on the decline since about mid-July, late July, and we continue to want to push that number down. When people talk about waves of illness and infections that transmit, we want to be careful about using that terminology about the first wave being over, or that whether or not a second wave is coming. We know that diseases, particularly ones that are produced or transmitted through respiratory contact, that those continue to circulate in communities even if we don't see giant spikes in cases. And so we are hopeful about the decline we see in cases. We know that there comes a point where once you can get the transmission so low that very few people get affected by it, that changes the dynamic of transmission. If it continues to go up, as we saw in June and July, that you hit sort of this point of exponential growth where lots and lots of people are getting it, and we have to work really hard to slow down that transmission and suppress that transmission as much as possible. So we are hopeful at what we're seeing in our community. We want people, this is not the time to quit the interventions that you've been doing all along. This is the time that we want to keep pressing forward and keep up with all of those interventions so we can continue to see the case rates go down. We can continue to see transmission decrease. We still want everybody who is ill or has concerns about COVID to stay home. That if you are notified or you find out or you have any suspicion that you might have come in contact with someone who has COVID, to stay home, because that keeps you from transmitting to other people. Take all of the precautions that are recommended while you're out in the community. If you have any concerns, contact your healthcare provider. See if you need to be tested for COVID and for other things. And then get tested if it's recommended for you. And take all of the precautions to reduce transmission to people in your household, people in your workplace, people in our community. And so we hope to keep seeing this case rate go down. We are hopeful that this is the tail end of it, but we know that if we let up with all of the things we've been working on for the last 6 months, we run the risk of letting transmission increase again.
Okay, got it. Thank you.
Okay, thanks, Kim. Emily, 29, do you have any follow-up?
I do. So, Ryan, I guess this is a question for you. If this letter of resolution is, let's say it's accepted by the governor and he comes to you and says, you know, what does Kern County want to see in our reopening plan? What might you guys ask for?
I'm sorry, if you could repeat that one more time, you're a little low on the volume.
Yeah. Oh, I'm sorry. Okay, so if the governor receives this letter of resolution that you wrote, and he comes to you for your input, what might you ask for in a reopening plan?
So the board made clear that clarity, consistency, continuity in the state's directives that they're putting out, not just for California's counties, but for California's business community and all of the residents here in this state. It's important to have that. It's important that the administration works more closely with counties in developing a pathway to getting the economy back open, getting kids back into school. Typically, these state directives and the rules and requirements are told to us just hours before they're announced. That's typically how it's been done. We'd like a little bit of a greater role and greater input in that. We want to make sure that these changing and new goals and objectives that are coming out are not unnecessarily penalizing, whether it's a county or the business community, our parents, our children. We don't believe that they need to be penalized not going back to school, our businesses not opening, even if it's under limited circumstances. We don't believe they should be penalized when the governor is moving goals and objectives that we believe aren't necessarily directed at maintaining local hospital capacity, which is what this was about from the beginning. We think that is the most important. We continue to believe that is the most important objective here, given the fact that this virus is here. It's not going away. It will continue to spread. It's how it is managed here and across the state. So we will be, we're simply asking the governor to avoid adding in new criteria that we have to meet. Don't make this any harder. Don't continue to shift goals and objectives. It is already hard enough for counties. We're having to pivot, adapt, reprioritize at great time and expense, at utilization of tremendous resources each time this is done. And we're asking for some consistency and greater collaboration with counties overall. I don't believe that it'll be just us and our county asking the governor for this. I believe other counties will be joining us and providing their input to the governor, doing their own resolutions and their own letters. But that is the impetus behind what the board did on Tuesday. So I hope that answers your question.
Yeah, it does. I also had one more question about the Condors raffle. So how does that work? People can go get tested, and then, how do they enter this raffle?
Yeah, so people go get tested, and you can submit your name and proof of test a couple of different ways. You can go to the bakersfieldcondors.com/COVID-19, and you can also email COVID-19 at bakersfieldcondors.com. to be entered into this drawing. The drawing will take place at the end of the year. Can people enter multiple times? They can enter multiple times with each test, proof of each test. That drawing will take place at the end of the year. I understand that the event industry is closed down for this period of time. This is for the 2021 season, beginning in January, and it goes for the entire year. We don't know where we'll be as a county or as a state going into 2021 with regard to what business activity is taking place. It is uncertain, but this is a terrific, very generous gesture by the Condors organization and Mechanics Bank. This is 2 tickets for every single event that happens at the arena during 2021. We hope that events we're able to get going, and we hope events are able to take place, if not at the very beginning of 2021, at some point over the course of the year. I'm told that we've already, Mr. Riley has already received several entries, just as we're talking here in real time. So thank you for that. Again, bakersfield.condors.com/COVID-19, or you can send your information in to COVID-19@bakersfieldcondors.com. And I also believe that you can simply, if you have more questions about this, simply call the Condors front office, and any of those people there that answer the phone will be able to assist you in understanding how you can submit your entry. But thank you for that question.
Okay, great. Thanks.
Okay, we're going to go to the Californian. Sam, do you have any more follow-up?
All good. Thank you.
Okay, and 17, I believe, was that Moses 17?
Yes, good morning. It is Moses here.
Hey, good morning, and congratulations on your job. We're happy to have you here in Kern County.
Thank you very much. It's great to be here. Really great to be here.
Yes.
I just wanted to ask a very quick clarifying question about the initiative with the Condor Stadium in order to win potentially free tickets for each of the events in 2021. So once someone gets tested, are they automatically entered, or do they need to follow any type of procedure in order to be entered in?
No, they have to follow a procedure. We're not able to provide that information to the Condors, but people can voluntarily on their own provide that information, which is why Mr. Riley and the Condors organization has set up 2 different ways that individuals who get tested can attest to the fact that they did get tested. They can either visit the bakersfieldcondors.com/COVID-19 website, or they can email their information, their name, contact information, and proof of test to COVID-19@bakersfieldcondors.com.
Okay, thank you very much.
Yes, sir. And with that, I think those are the final questions. Appreciate everybody joining us this morning, and we'll see you next week. Be safe.
All right, and again, you have been listening to the weekly update from county officials and health officials on the latest on the COVID-19 crisis here in Kern County. As you heard right there at the end, talking about the new testing initiative that the Bakersfield Condors is joining together with the county for, trying to get more people tested in Kern County. If you get a test for COVID-19, the Condors is going to put you in a drawing for a chance to win 2 tickets to any arena show or Condors game next year for 2021. Again, testing is a big issue here in Kern County because right now we're testing below the state average. And because of that, the state is artificially inflating our case rate, which pushes us above one of the metrics, which is the state measures when allowing us to move in a different tier therefore allowing more businesses and organizations to reopen around Kern County. And today, Kern County health officials reiterated we would need to have somewhere around 690 people tested in addition every day to those we're already testing. So they're asking people to just go get a test, make it a weekly thing perhaps. You can go to you can call 211 or go to kerncounty.com to schedule a free test. There are several areas you can go here in town to get that done for free. And again, once you do that, now this initiative with the Condors is going to allow you to possibly be entered to win some tickets to some shows next year. And you'll do that by going to bakersfieldcondors.com/COVID-19 or emailing COVID-19@bakersfieldcondors.com. We're going to have much more on the new data that was released today, as well as the new testing initiative coming up today on 17 News at noon and 5 and 6. For now, from the 17 studio, I'm Maddie Jansen for 17 News.